Hello everyone, you're welcome to my YouTube channel. This is Miss Stephanie again. Okay, in today's video we're going to be talking about aplastic anemia, which is one of the various common types of anemia. All right, now we're going to be talking about aplastic anemia, its cause, the signs and symptoms of this anemia, the diagnosis, and the various ways to manage or to treat this anemia. We're going to move down now to the cause of this aplastic anemia. Aplastic anemia is being caused when there is failure of the bone marrow or the stem cells to manufacture red blood cells in adequate number. At times, aplastic anemia is not being caused by anything, but instead it is inherited. That is, like you have leukemia, it is actually inherited from maybe from your parents, your grandparents. The third cause of this aplastic anemia is from chemicals. Example, like you have carcinogenic drugs. You can definitely come out with anemia from carcinogenic drugs. Benzene, when you're being exposed to chemical like benzene, you can definitely have this aplastic anemia. All right, so those are the causes of this aplastic anemia. All right, now we're going to move down now to the the sign and symptoms of this aplastic anemia. First, we have fatigue. Second, we have nose bleeding, and the third, we have bleeding of the mucus of the mouth. The fourth, we have dyspnea. There is difficulties breathing. All right. The fifth, we have weakness. The fifth, we have weakness. The sixth, we have pallor. That is, you become more pale. The seventh, we have bleeding tendency. The eighth, we have headache. The ninth, we actually have lower resistance to infection, and the last, we have fever. All right, so those are the signs and symptoms of aplastic anemia. All right, now we're going to move down to the diagnosis of this aplastic anemia. But before we go to that, if you're new in this channel, do well to subscribe, like, and also share my YouTube videos. All right. Okay, now we're going to move down now to the diagnosis of this. Okay, now how can this aplastic anemia be diagnosed? First, you have complete blood count. Second, you have bone marrow aspirate. Then the third, which is the last way to identify this aplastic anemia, you have the symptoms, and also you ask history of being exposed to chemicals or other agents, like maybe you're taking an anti-carcinogenic drugs, or maybe you're exposed to chemicals like benzene and others. All right, so those are the ways to diagnose this aplastic anemia. Now we're going to move down to the last part of this video, which is the various ways to manage and to treat this aplastic anemia. First ways to treat this aplastic anemia, we have bone marrow transplant. Second, we have blood transfusion. There is blood transfusion, that is including red blood cells, platelets, and white blood cells that are actually being transfused as necessary. The next way to manage this aplastic anemia is to avoid exposure to chemicals. Then you also have you increase intake of fruits and green vegetables. So that is all what we have for today's video. Thank you for watching.